is Katoa, and I'm a clinical psychologist in the Department of Psychiatry. Prior to this pandemic, there have been estimates that up to 20% of patients in medical clinics experience some kind of health anxiety. Health anxiety comes up when we perceive there's a threat to our health, which then triggers an anxiety response. Anxiety is our fight or flight response to danger. When we're facing real danger, this alarming response helps us survive. When we're not, this response sets off a false alarm that can cause us a lot of distress. That means there's a distinction between helpful anxiety and unhelpful anxiety. Having some anxiety about a health symptom is helpful if it gets you to take reasonable steps to address it. But having anxiety is unhelpful if it becomes consuming and leads to maladaptive thoughts or behaviors. So let's get more specific and define health anxiety. First, it involves health concerns that are excessive. These concerns are out of proportion to the actual likelihood of having a serious illness. The concerns are persistent despite negative test results or reassurance from your healthcare providers. The anxiety leads to unhelpful behaviors like excessive checking of symptoms, reassurance seeking, or other avoidance behaviors. It can also cause significant distress or interferes with one's day-to-day functioning. Here are some examples of health anxiety. Let's say I see a sore on my skin. This leads to worries about cancer, skin cancer, and I check my body every hour to see if that sore may be cancerous. Or maybe I have heart palpitations. That leads to worries about having a heart attack and dying. Even though all my cardiology tests came back negative, I'm still convinced I have heart problems, and I'm constantly Googling my symptoms online. With the COVID-19 pandemic, people are now experiencing more triggers for health anxiety. These may be internal triggers, like feeling unwell, or they may be external triggers, like seeing other people get sick or seeing reports of rising COVID cases each day. Now let's take a look at some strategies for managing health anxiety. In order to get better, we have to understand the different components of health anxiety. According to the cognitive behavioral treatment model, health anxiety is maintained and perpetuated in several ways. Unhelpful health-related thinking. These are our worries and our fears. Increase in anxiety symptoms. This is essentially our fight or flight response. It may include symptoms like stomach upset, headaches, or muscle tension. Increase focus on physical symptoms or increase focus on a certain part of our body. Checking and reassurance-seeking behaviors, avoidance or safety behaviors. Now, it's easy to get caught up in these behaviors because we want to make sure we're okay. But the problem is repeated checking and repeated avoidance only sends more danger signals to our brain. It sends the message that something's wrong here, and that increases anxiety over time. So let's start by tackling unhelpful thinking. Step one is to identify your unhelpful thoughts. What am I worrying about? What am I predicting? What conclusions am I jumping to? Try to get to your core fears. Step two is to examine your unhelpful thoughts. What do the facts or data show? What actual evidence do I have for and against this unhelpful thought? What are the costs of holding on to this belief? Are there other possible explanations for my symptoms? What's the most logical explanation for this? What can I do to cope if the worst happens? How can I get help? And what is a more realistic way I can think about the symptom or situation? Reduce anxiety symptoms and reduce focus on physical symptoms. Relaxation exercises are a great way to start. You can consider doing diaphragmatic breathing, guided imagery, or muscle relaxation exercises. Attention training is something else you can try. The goal of this is to shift your attention away from your physical symptoms. Try focusing on a mundane task instead. Practice sustaining your attention on it for a little bit of time, and then gradually for longer and longer periods of time. Then there's meditation, which is a great way to practice being in the present moment. As human beings, it's natural for our minds to drift off. When that happens during meditation, you can gently guide it back so your mind can practice being in the here and now. Reduce checking and reassurance-seeking behaviors. This is an important step in reducing health anxiety. You may have seen check-in behaviors such as checking your body or looking up symptoms online. Or there can also be mental checking behaviors, like going over what you know or remember. Did my mole look any different last week compared to this week? What did the doctor say about what's normal versus abnormal? Then there's also reassurance seeking, maybe from family, from friends, or even from your healthcare providers. Try to delay or postpone these behaviors. You may want to set some limits with yourself. Maybe only allow myself to be online for a certain amount of time, or I may limit myself to only one website, one credible source that I go to when I have questions about my health. If it's too hard to cut down all these things at once, it's okay to cut down gradually. You can also consider getting help from family and friends, maybe asking them to cut down on their own reassurance giving. Lastly, reduce avoidance or safety behaviors. You can think of safety behaviors as a more subtle form of avoidance, such as avoidance of people, places, or activities that remind you of illness or mortality. Examples include avoidance of doctors, hospitals, sick people, or avoiding doing anything that may make your body feel uncomfortable or feel sick, carrying around medications or carrying around a phone just in case, or really creating any other rules to ensure safety. To cut down on these behaviors, you can pick one to start with, set a goal for yourself, and work your way up. So if my goal is to go into the doctor for a checkup, I may start out by thinking about a past conversation I had with my doctor, then jotting down some things I want to talk to her about now, to maybe looking up a picture of her online, and then going onto my chart and checking her messages and health reminders. And then I may check her available appointment openings, and then come back another time to schedule and gradually work my way up towards going into the office. The key is to take it one step at a time so that you can work your way towards your goal. I hope you found this video to be helpful and that you can try some of these strategies to take good care of your health.